Welcome to the Patient Care Process Preceptor module. My name is Ann Thompson and I'm the Director of Experiential Education at the Faculty of Pharmacy and Pharmaceutical Sciences. Preceptors are an integral part of the pharmacy program, and we hope you, both new and seasoned preceptors, find this module useful. The creation of this module involves the work of many talented preceptors and faculty members. We hope you find their presentations helpful and examples useful for you to use as you approach the patient care process with your student. We also welcome your tips and stories. What has worked well? Please share with us, and do this by filling out the evaluation online at the end of this module. Thank you. This module was developed to guide you in precepting your student through the patient care process. We know that preceptors are integral to our program. You are the frontline practitioner who is assessing and evaluating the skills and knowledge our students possess. You also role model and reinforce skills in the real patient care setting. Preceptors providing feedback to the faculty has the power for change. The need for this process was identified in part through you as a preceptor providing feedback to the faculty about the lack of consistent patient care process as demonstrated by students. While the patient care process is not new, it was felt that implementing a systematic framework for use within the curriculum, including experiential courses, would foster more consistent application of the process within practice. This served as the impetus to create a document entitled Patient Care Process, which is posted on the Experiential Education website and outlines the approach to each element involved in providing patient care by a pharmacist. The outline of this presentation will review the learning objectives, rationale, and philosophy of the patient care process document as well as this module. We will then provide an overview of this module, show you which patient care processes will be included, discuss the expectations of the student and year of study, student professionalism and patient care, written care plans, feedback versus evaluation, and next steps. At the end of this module, preceptor participants will be able to understand why and how the patient care process document was developed for student use in the curriculum. You will be able to recognize the patient care process as described and understand how you can help the student effectively apply his or her patient care skills in your clinical practice. You will be able to provide feedback and evaluate the student's patient database, assessment of drug therapy, care plan, and documentation for a specific patient, and know how to guide and support your student through the patient care process document in your patient care process. The rationale for this process is twofold. First, we want to expose students to various processes, frameworks, and terminology with each aspect of the patient care process so that secondly, they learn and apply it throughout both coursework and experiential courses and rotations. This process was chaired by Michelle Foisey with a working group of pharmacists across broad practice settings, including community practice, primary health care networks, hospital inpatient, ambulatory care, and faculty of pharmacy members. The group was kept small so that it could be functional. Opinions of others were sought as needed and identified by the working group members. The patient care process is a comprehensive one. It involves an initial patient assessment, including the medical and medication history, assessing and identifying drug-related issues, developing a pharmacy care plan, and then documenting the care provided. The language and organization is simple and consistent with other healthcare disciplines so that our students have a similar systematic approach. Generic data collection forms were avoided in order to encourage learners to think about key information required in order to provide care to a patient. We hope this framework enables students to create their own individualized forms if they feel they would help them with their patient care process as they learn in practice. Finally, this process was intended to be flexible and adaptable to any practice site, allowing the student to decide, in conjunction with their preceptor, how the process will be carried out in their practice. This module has 6 independent sections. This introduction is followed by creating a patient database, assessing drug therapy, the pharmacy care plan, and finally, documenting the care you have provided. There is also a concluding presentation to summarize what has occurred throughout the module. They were all developed from the perspective of the preceptor while they are precepting a student and demonstrating as well as coaching the patient care process in practice. Each section of the module has 4 main components. They include setting the stage, elements of the patient care process being discussed, feedback and evaluation, an overview of the preceptor role. The sections of the patient care process follow a logical sequence, but are designed to allow for independent viewing. So here's a diagram of the patient care process, and it is intended to illustrate each of these sections that are included in the module. At the top of the circle, we start with patient assessment, which involves gathering information and creating that patient database, and then evaluating that information, which is a dynamic process. As you move to the right of the circle, you start to assess that drug therapy and develop a care plan. You then implement the care plan towards the bottom of the circle and follow up and monitor your patient accordingly, which then leads into a subsequent patient assessment. At the core of all of this is communicating with patients and other care providers and documenting that care so that others know the role that you are playing. The role of the preceptor is to support and build upon the student's knowledge and skill that they have learned in the program. The preceptor role will be similar regardless of student year of study, and for students, their skill and knowledge continues to build over 4 years. We introduce this process in the first year and then continue to build. The depth to which your student can complete the various elements within the patient care process may differ as they progress from early or first and second year experiential courses to advanced or 4th year experiential courses. You need to align your expectations of the student with their knowledge and skill set, and this is generally guided by the course activities and objectives which have been designed at each point in the curriculum to support and guide you through the process. Of note, new Skills Labs courses have been created and are being implemented within the curriculum in 2nd and 3rd year to foster the development of patient care skills as students learn within the therapeutic courses. The systematic approach of the patient care process is a backbone of this course and will provide students with practice before entering most of their experiential courses. Professionalism, your student, and patient care. Professionalism is a core expectation of students in all patient care activities. You act as a role model for this. This means that your student must demonstrate professionalism throughout patient encounters and practice in an ethical manner which ensures primary accountability to the patient and the healthcare team. Examples of behaviors expected include maintaining a professional image, using appropriate language and demeanor, showing respect for patients and healthcare team colleagues, accepting responsibility for recognizing and meeting patients' medication therapy needs, maintaining patient confidentiality, and fulfilling their professional tasks and commitments to patients and yourself in a timely, reliable, and respectful manner. The students learn professionalism at the faculty. This includes proper attire, attitude, and behavior when in the practice lab. We expect this to continue in experiential courses. Should you identify any concerns with your students' professional behavior, please contact the course coordinator. Often, students will say, "My preceptor doesn't write down their care plans, so why do I have to?" This is not really done in practice. Well, we also know that practicing pharmacists and preceptors don't always write down their plans and make many decisions in their head. Preceptors also have experience that students don't. Additionally, practicing pharmacists do write out their care plans at least some of the time for competence assessment and for applying for expanded scope such as additional prescribing authority or as part of their documentation. Students are learners and as such better learn a process and commit to certain decisions when they write down what they are thinking on paper. This serves to help them learn an active process and you to assess and evaluate their knowledge and decision-making skills. Feedback versus evaluation. Feedback is verbal or written, whereas evaluation tends to be written only. Feedback is a two-way process where both the preceptor and student can learn with and from each other. Your feedback helps to guide and develop the student's future performance, should occur frequently and regularly throughout the clinical placement, and should be constructive. Evaluation is a summative process and involves global student performance across specific learning objectives. It is usually completed at predefined time points, such as midpoint and the end of the clinical placement. Suggestions for feedback and evaluation are provided within each section of this module. So what are the next steps? We suggest that you have a copy of both the patient care process document, which is found on the website and can be downloaded and printed, and a copy of the Preceptor Practice Assessment Worksheet, handy when viewing and listening to each section. The Preceptor Practice Assessment Worksheet is a way for you to reflect on your own patient care practice and write down any pertinent thoughts that you think of as you listen to each section within the module. Use ideas from the presenting preceptors, and please contact us with any questions. The Office of Experiential Education phone number is 780-492-5825, or you can email us at the address as shown on this slide, which is xed@pharmacy.ualberta.ca. I hope you enjoy the following sections. Thank you.